Sanfilippo syndrome, also known as mucopolysaccharidosis type 3, MPS III, or sometimes referred to as childhood dementia, is a rare, incurable, lysosomal storage disorder, a subcategory of metabolic diseases. This disorder affects the body's ability to break down certain complex sugars called glycosaminoglycans, or GAGs. Specifically, heparan sulfate, which is the key biomarker for diagnosis. This condition is caused by mutations in one of four specific genes: SGSH, NAGLU, HGSNAT, or GNS. There are four types of Sanfilippo syndrome, types A through D, that correspond with one of the four mutations. Type A is the most common but yet most severe form of this disorder. Each gene mutation leads to a deficiency in a vital enzyme responsible for breaking down GAGs, resulting in their toxic buildup within cells. This causes accumulation in brain areas similar to Alzheimer's dementia. Since Sanfilippo syndrome is an autosomal recessive disorder, both parents must carry a mutated gene for a child to inherit the condition. Symptoms typically appear between the ages of 2 and 6. Early signs often resemble those of developmental delay, including speech difficulties, behavioral problems, and hyperactivity. The child often has physical features including big, bushy eyebrows, coarse and thick hair, and larger lips. Over time, symptoms progress to include cognitive decline, mobility issues, seizures, and eventual loss of basic skills. Sadly, Sanfilippo syndrome is considered a terminal condition, often resulting in a reduced lifespan. Most patients reach death before adulthood, with some not even reaching their teenage years. Diagnosing Sanfilippo syndrome can be challenging because early symptoms resemble more common conditions like ADHD or autism. However, specialized tests can confirm a diagnosis. These include urine tests to detect elevated GAG levels, enzyme assays to assess enzyme activity, and genetic testing to identify mutations. Early diagnosis is essential to explore potential treatment options. While there is no cure for Sanfilippo syndrome, several treatments aim to manage symptoms and improve quality of life. Supportive care such as speech therapy, physical therapy, and behavioral interventions play a crucial role. Some medications may help control seizures and manage sleep disturbances. Research has also explored enzyme replacement therapies to restore missing enzyme function, although clinical outcomes have faced challenges. Promising advancements are paving the way for potential breakthroughs. Gene therapy is at the forefront, where researchers are developing techniques to introduce functional genes that replace faulty ones. Additionally, substrate reduction therapy aims to reduce GAG production, potentially slowing the disease's progression. Stem cell research has also shown encouraging signs, particularly in improving neurological outcomes. Although these treatments are still under investigation, they offer significant hope for families affected by Sanfilippo syndrome. Raising awareness about Sanfilippo syndrome is essential to driving research and improving support systems for those affected. If you'd like to learn more or contribute to research efforts, consider reaching out to organizations dedicated to fighting rare genetic diseases. Together, we can push science forward and bring hope to families in need.